Welcome back to News Hour. I'm Charles Anigolo. Now, here in Nigeria, a mass vaccination campaign is getting underway against yellow fever, a mosquito-borne disease that kills tens of thousands of people worldwide each year. It's hoped 25 million people will be immunized this year in Nigeria after the emergence of hundreds of cases in recent months. It's the country's largest ever vaccination drive and is being carried out by the Nigerian government along with the World Health Organization and UNICEF. It's part of a wider global effort to eradicate yellow fever outbreaks by 2026 and will begin in Nigeria, in Kogi, Kwara and Zamfara states. Nigeria is currently battling an outbreak of yellow fever, which began in the West in September 2017. In late 2017, it vaccinated more than 3 million people, but this didn't stop the spread of the disease. At the start of this year, 45 people had died from yellow fever. Meanwhile, Nigeria is also facing outbreaks of other diseases, including meningitis, Lassa fever, cholera, and so-called monkeypox. Well, for more on these developments, I'm joined now in the studio by the Chief Executive Officer of the Nigerian Center for Disease Control, Dr. Chikwe Ihekweazu. Thank you very much indeed for coming in. I know this isn't, I mean, you cover a wide spectrum of outbreaks and diseases and that sort of thing in Nigeria, but it's the responsibility of another department to deal with yellow fever. You're here to talk more about Lassa fever, but let's just get your take on this vaccination campaign. It is the biggest Nigeria has ever seen, and it is concentrated in certain parts of the country, not across the entire country.
Yeah, so we're doing a big vaccination campaign for yellow fever. It's led on by the National Primary Healthcare Development Agency. The thing with Lassa fever is actually a pity that we have to do a campaign, because this is an illness for which there's a very good vaccine. It's part of the
yellow fever or Lassa fever?
Yellow fever.
Right.
It's part of the childhood immunization schedule.
Right.
So theoretically, every child in Nigeria should get vaccinated in childhood and therefore get protection throughout life. So there's been a massive effort by the agency, by the Nigerian government to increase access to vaccination, but there's a lot of responsibility on people's parts as well to take their children for vaccination. So because our vaccination coverage rates are not as high as they should be, with having more cases of yellow fever. Now, yellow fever, when it does become an outbreak, it could really become very bad. So really this vaccination campaign is a preemptive measure by the Nigerian government to stop a really massive outbreak of yellow fever happening.
Nevertheless, there have been quite a few cases. I understand about up to 300 cases.
Yes, there have been cases, but you know, yellow fever outbreaks can be really bad. So you know, we haven't gotten to that tipping point where you have thousands of deaths. There have been some big ones in the past. There was a big one in Angola recently, and then in Brazil. So we're lucky, and actually the proactiveness of the Nigerian government and partners by carrying out this campaign will potentially stop that kind of big outbreak from happening.
And I mean, you mentioned, I mean, it's 25 million people. That's a lot of people. That's a lot. You know, that's also presumably quite expensive.
It is hugely expensive, and not just the cost of the vaccine, because that's what really comes to mind. The biggest cost actually is in mobilizing the number of healthcare workers, the logistics, all the infrastructure required to carry out such a big vaccination.
But you are on top of it.
Absolutely. This is led on by National Primary Healthcare Development Agency. It's been in plans for weeks and months, and I'm confident they'll carry out a great campaign.
And how powerful are these vaccination doses? I mean, will they last for a few years or for life?
We have a very good vaccine for yellow fever, actually. Previously, it was thought to provide immunity for just 10 years, but now recent evidence actually shows that it provides more or less lifetime immunity, and subsequently we've removed the requirement for second and third doses of the vaccine after your first shot. Right.
Now, let's also talk about the other diseases, if you like, that are hitting Nigeria. I mean, you're dealing directly with Lassa fever, which you're trying to contain. Tell us about that. What is it, and how much of a danger is it?
Yeah, so Lassa fever is a tough one. Firstly, there's no vaccine available. Secondly, it's not so widespread, so most cases really happen on the West Coast. A lot of cases in Sierra Leone, but by far we have the largest burden in the world. Last year we had the highest number of confirmed cases ever, and this year in the first 3 weeks we've had more cases than we had in the first 3 months of last year. Now, on the flip side, this is really a disease that we shouldn't be having.
Right.
It's transmitted through rats to humans, mostly through infecting foodstuff, you know. So we've got to really work harder in preventing that transmission from happening. And often the message is about covering your foods and all of that, which is all well and good. But I think if you go around Nigerian cities at the moment, all over the country, east, west, you know, you see refuse dumps, you see litter.
Absolutely.
So we really have to take this seriously. And it's the challenge is not just for members of the public, the population, for doctors, for leaders. This is not one that there's no magic bullet. It's not something that NCDC can do and it'll stop this outbreak. It's something we really have to come together.
But I imagine that makes your work extremely difficult, because I mean, here you are trying to mobilize action, and yet everywhere you look, I mean, it's like people are creating homes for rats.
It's extremely difficult. It's extremely difficult. It's we're in a resource-constrained environment. That aspect of our society is not fully organized the way we would wish. And so there's no one agency that can solve this problem. It's really, we have to come together as a country and really raise the bar. And that's been our message lately.
Right.
Don't expect a magic bullet. There is none for Lassa at the moment.
But how deadly is Lassa fever?
Lassa is quite bad. We have a case fatality ratio of about 15 to 20%. It's very similar to Ebola, but the number of deaths is a lot lower. And the difference, the transmission ability is also lower than Ebola. So it's in a way, in a good way, to prepare for something worse. And ultimately, what we really want is that this will enable us really grow our defenses, so that if there's something really bad, we're able to act appropriately.
So what assurances can you give to people listening to this, watching this program now, and possibly getting paranoid and panicked?
Yeah, so panic is the worst thing that could possibly happen. So the first line of action, obviously everyone has heard about the cluster of cases in Abakaliki among healthcare workers, and we're really assuring healthcare workers, working with them, if they use universal precautions, personal protective equipment the way they should, they will be protected. Advocating for hospitals, both in private and public sector, to really invest in these basic things. We will support every facility in state capitals to ensure that at least there's one center that can have the capacity to respond. So in various ways, we're supporting the states to carry out response and prevent, and developing jingles, messages, and all of that. But, you know, it's a big and complex country, and we can't be everywhere all the time. So we really need everyone to come to the table. We need hospitals and chief medical directors to take this seriously, identify an isolation facility where you can manage cases. But really, ultimately, our biggest tool in this disease is prevention. Prevention from access to our foodstuff, and secondly, prevention from person-to-person transmission. The biggest group at risk are healthcare workers.
Well, Dr. Chikwe Ihekweazu, Chief Executive Officer of the Nigerian Center for Disease Control, thank you very much indeed for coming in, and we do appreciate your coming, because I know you've got another appointment, so thank you for coming to enlighten people of Nigeria about this.